We're going to talk about venous sinus thrombosis. Pregnant patient, she has been into C-section postpartum 5 days. She was presented to us with headache and left side weakness and one episode of generalized tonic-clonic seizures. We have done CT brain, and CT brain show the hyperdensities in the parietal lobe, and so we say this is the parietal lobe bleed. So this is cortical bleed, and we can see here, this is the ventricle, this is the left side of ventricle, and this is right side, left hand and right hand. If you compare the both side, this side is black and this side is white. White mean that there is blood, so there is intraventricular extension. So the cortical bleed with intraventricular extension, parietal lobe bleed, parietal lobe में cortical bleed and with intraventricular extension. ventricle में भी hyperdensities नज़र आ रहे हैं, whiteness नज़र आ रहे हैं, तो इसका मतलब है यहाँ पे भी हमारे साथ blood है. In this condition, when we see the cortical bleed, the bleed can be here, and there. So this is cortical bleed. Whenever you see cortical bleed, you have to rule out two things. That bleed may be aneurysmal bleed, or that bleed may be venous sinus thrombosis. So for that, we are going to do, to rule out the aneurysm, we will do CT angiogram, and to rule CVST, we will do CT venogram. So here, this is the CT angiogram. In angiogram, you will see the blood vessels, the arterial blood vessels. This is circle of Willis. So this is normal. There is no aneurysm in this. So this is CT angiogram. There was no aneurysm, and this is CT venogram. Venogram, we are looking for venous thrombus. Here, if we see, this is sagittal sinus, this is transverse sinus, this is sigmoid sinus. If we compare both, this is right side, this is left side. Compare both sides. Here you can see this black contrast is going like this. The contrast is going easily, but this side the contrast is not going. So it's mean, but here we can see this contrast is coming here. This area we can say this is hypoplasticity, but sometime if you see a little bit black and white, that will be thrombus. So that's how we can say cerebral venous sinus thrombosis. But here this area was hypoplastic. So that's why the next confirmation modality is DSA. On DSA, it was confirmed the patient were having cortical venous thrombosis, and that's why this patient was diagnosed with cortical venous thrombosis. But CVST, cerebral venous sinus thrombosis, you will see here a clear cut, a bit whiteness and a bit blackness. Mean the contrast, you will see a little bit contrast, and then you will see the thrombus will be here. Okay, I already uploaded another video on that, kindly watch it. Thank you. The treatment or the history of this patient, 30-year-old female with no previous comorbidity, was presented to us with left side weakness, headache, and generalized tonic-clonic seizure with one episode. She was pregnant 5 days ago. C-section was done, so today was postpartum day of 5th day. And we did CT brain, and CT brain we saw the right parietal lobe bleed with intraventricular extension. So this was the cortical bleed. And as I say, whenever we see the cortical bleed, we will do CT angiogram and CT venogram. CT angiogram to rule out aneurysm and CT venogram to rule out CVST. इस पेशेंट में हमने CTA किया, CTA अनरिमार्केबल था, और CTV में हमारे साथ जो है ना हाइपोप्लास्टिसिटी थी. तो फिर हमने क्या किया, इसके बाद हमने DSA किया. तो DSA पे कॉर्टिकल वेन में थ्रम्बोसिस थे, जहाँ पे हमने इसको डायग्नोज किया कॉर्टिकल वीनस थ्रम्बोसिस. कॉर्टिकल वीनस थ्रम्बोसिस, एंड दिस पेशेंट वाज हैविंग GTCS, generalized tonic-clonic seizures, and headache. So for and thrombus. Now for the headache, we give the magnesium sulfate 2 gram. This is the injection magnesium sulfate 2 gram IV in 100 ml normal saline. IV BD या TDS में भी दे सकते हैं. And then another mainstay of treatment for the CVST or DVST, we see the Clexane 60 mg subcutaneous BD. So this is the injection Clexane 60 mg subcutaneous. We give it subcutaneous in BD morning and evening. Now high top 2 pyramid, which is 25 mg. This is high top 2 pyramid 25 mg. This is for headache, this is for fits, 25 mg for oral BD morning and evening. Injection Ryzik, as the patient is bedridden now, so we will give injection Ryzik to protect the patient from aspiration or gastric, like aspiration pneumonia. Injection Fulgan with the SOS. This is paracetamol. In infusion, we can give TDS or we can give in BD. The another one, the patient was having fits, so we give Lires 500 mg IV BD. This is levetiracetam, so 500 mg BD. Now the mains after that, the mains, when we are going to discharge the patient, we will give except 15 mg in morning and evening for 21 days, and then the patient should be shifted to accept 20 mg 1 UD for 3 to 6 months. And then we also give for the headache, we will give also high top 25 mg 1 UD for 7 days, and then 1 BD in morning and evening, and this should be at least for 2 to 3 months. So the mainstay of treatment for CVST or DVST is Clexane 60 mg subcutaneous BD and for 5 days, and then accept 15 mg in morning and evening for 21 days, and then it should be shifted to accept 20 mg 1 UD for 3 to 6 months.